Good morning, hello, and welcome to everyone who's on this webinar this morning. This webinar is being hosted by APA's Division 52, International Psychology. This webinar is part of an ongoing series to celebrate activities of psychologists around the world, to provide useful information for international engagement, and to encourage us all to take a broad and global perspective. My name is Dr. Karen Brown, and I am your host for today's webinar. Before we begin, we'd like to remind our online audience that you have the ability to ask questions by typing them in the chat box located at the bottom right of your screen. We ask that you use the chat box and not the Q&A box so that we can more easily track your questions. Please feel free to type your questions during the presentation, and I will be making a note of them, organizing them, and during the last 10 to 12 minutes or so, I will present them to our guest speaker for discussion. Today, our guest speaker is Dr. Falu Rami. She is a licensed marriage and family therapist in California and holds a PhD in international psychology. She is an independent consultant currently providing critical incident stress management services and counseling support for COVID-19 and is a clinical program director for a crisis residential program. She is a country conditions expert and conducts immigration psychological evaluations and reports for individuals filing for a variety of immigration and asylum claims. Dr. Rami has been actively involved in Division 52 for several years with the Early Career Psychologist Welcome Committee and is a co-chair of this webinar committee. She is involved in several APA interdivisional projects, including the Codepar Interdivisional Immigration Project, and is involved in multiple work groups for the APA Interdivisional COVID-19 Task Force. She has an extensive clinical background and has worked with a variety of underserved and marginalized groups in multiple settings. Dr. Rami was part of the APA delegation to Kosovo in 2019. Her presentation today is based on her dissertation of interviewing humanitarians that worked with Syrian refugees in multiple countries. I present to you now Dr. Falu Rami.
Good morning, everyone, and thank you, Dr. Brown, for that warm welcome. My presentation is titled Humanitarian's Perceptions of Syrian Refugees Adjustment Experience, and is based on the Interpretative Phenomenological Analysis study that I had done. So before we get started, I wanted to go over a little bit about what sparked my interest in the study. First of all, my own background as an immigrant from India and going through the adjustment experience in the United States is something that sparked my interest in the studies. In addition, I'm very much interested in intergroup conflict, which I also have experienced not only in my country of origin, most particularly between the nations of India and Pakistan, but also between ethnic and religious groups, as well as intergroup conflict in the United States. I also have experience in structures and institutions that maintain intergroup conflicts, which are longstanding and intractable. So that's another passion of mine to explore and study. In addition, my own experience providing humanitarian services, disaster mental health services post-Katrina, and my deep passion for the field of humanitarianism and doing humanitarian work, and experience in working with immigrants as well as refugees throughout my career. So I'm not going to go through all of the information on these slides because I realize there's a lot of information. There were 10 main sections in my background to study, so which included global migration trends, studying all the multiple factors that contribute to people leaving their cities and countries, and forced migration. So at the time of my study, UNHCR had reported in 2015 that over 65 million people had been displaced, and at that time 21.3 million of them were refugees, which was the highest number since World War II. I also provide some background information on Syrian history, which includes their history of colonization and division of the country, which also later contributed to some of the conflicts that we're witnessing right now. And then the other sections included sections on Syrian human rights violations, most particularly with ethnic and religious minorities, and then the causes of the Syrian civil war and the Arab Spring. And then these are my other sections for the background to my study, including looking at the Syrian war and the refugees. As I mentioned earlier, it was reported to be the largest humanitarian crisis since World War II. And at the time of my study, over 5 million refugees had migrated to geopolitical regions, neighboring regions, and over 6 million were internally displaced within Syria. I also take a look at humanitarian. So there's something called classic humanitarian versus new humanitarianism. And classic humanitarianism is usually associated with the beginning of the Red Cross and the services they provided. And new humanitarianism is marked with Medicine Sans Frontiers, Doctors Without Borders. And I also covered changes in humanitarian organizations and the interventions that they provide, and the different types of organizations that exist right now. So as I mentioned earlier, a really brief history of humanitarianism. Classic humanitarianism was associated with the Red Cross, and the principles during that time was to maintain neutrality and not be involved in any other things like political factors that may shape some of the things that were going on. And with Medicine Sans Frontiers and Doctors Without Borders, there was a shift in these humanitarian principles as we see through the years and through some of the crises that Medicine Sans Frontiers had decided not to participate in some of the crises that were involved or in some of the countries due to some of the atrocities that were going on. So that's where we see a change in humanitarian principles. The other thing I looked at briefly is, the humanitarian culture and the identity. There's multiple factors that go into identifying as a humanitarian. There's similarities in terms of the motivations to do that kind of work, similarities and values. Background and experiences include a lot of humanitarians have experience and openness to different cultures and providing services in different countries. They have knowledge of the different countries and cultures that they're providing services in, which is incredibly important. And then we see a shift in types of humanitarian, including like career humanitarians, but there's also short-term humanitarians, volunteer humanitarians, those that provide medical services, those that do research in conflict zones, as well as a new type of humanitarian which is emerging, which is military humanitarians, where the military provides humanitarian type services in certain settings such as Afghanistan, where there's protracted conflict and safety issues. And so the statistics that I've seen on the amount of humanitarians that provide services have ranged from as low as 210,000 to over 19 million employed. So of course that's a big range. In terms of humanitarian organizations, the traditional humanitarian organizations are NGOs, INGOs, as well as nonprofit organizations. But in the study with Syria, what I saw is that there are more non-traditional humanitarian actors that are starting to provide services on the scene. And they include diaspora networks, medical associations, such as Syrian Association for Medical Services, faith-based charities, civil society organizations, as well as anti-government activists and groups. So just really briefly, in terms of keywords and definitions, humanitarians provide roles and services in the context of a crisis or conflict. And they have attitudes about human rights and applications of ethics and benevolence when working with individuals, communities, and countries impacted by crisis. And the term humanitarianism is a practice of providing relief services and aid to crisis-affected populations of war, conflict, human rights violations, etc. A refugee is an individual who's forced to flee his or her own country due to fears of persecution because of race, religion, or orientation, as well as a couple other factors, and they've crossed an international border. So the problem statement for my dissertation is the reason I decided to do the study as we know, Syrian civil war is a protracted conflict. At the time of my study, it had been going on for 7 years, and over 5 million people have migrated, with over 1 million asylum applicants in Europe. And as we also know, most refugees live in low and middle income countries, up to 84% of them. And unfortunately, these countries have very limited resources that are available and infrastructures that are impacted. There's also been an increase in humanitarian organizations since the 1990s, 210,000 workers and up to $15 billion in global spending. And at the time of my study, when I looked at the Syrian Regional Refugee Response Plan, there were over 200 partner organizations that were providing services, and that did not include the local efforts in Syria, as well as countries outside of the neighboring regions, such as Europe, or cross-border projects that were going on. The purpose statement of this IPA study is to describe and explore humanitarian perceptions of Syrian refugees' adjustment experience. So there were several significant parts of the study. It explored the adjustment experience from a different framework. And the framework that was used was social constructivism, which I chose because it explores multiple realities and structures that influence the adjustment process. It also adds to the literature on humanitarianism, humanitarians, humanitarian organizations, as well as humanitarian interventions. It's beneficial for policies in migration, integration, mental health, as well as humanitarian organizations and training. And it also incorporates disciplinary views as well. A comprehensive overview of the mechanism, dynamics, and conditions that influence the adjustment process are explored through social constructivism. And it expands on the acculturation model used by Barry and Sam. It also contributes to refugee adjustment experiences. So most of the studies had been done in North America, Australia, Israel, New Zealand, and Europe, and this contributes to the refugee adjustment experiences outside of those countries. In addition, the study provides information from multiple countries, types of organizations, and humanitarian workers. So my main overarching question was, how do humanitarians perceive Syrian refugees' adjustment experience? And in addition to that, there were some screening questions that I had sent for the humanitarians to determine their eligibility for participating in the study, including getting information on their education, the countries they worked in and were living in, and the type of organization that they were working for, as well as their occupation, language, and experience. I also had an interview protocol with over 20 interview questions to assess various areas that would influence Syrian refugees' adjustment experiences. I was particularly interested in the role of media and politics and how that shaped attitudes towards refugees, along with the knowledge of Syria that humanitarians had prior to going and providing services to refugees, and information on their experiences and assumptions of refugees and interests in work that in turn shape their perceptions. There were two conceptual frameworks that I used, and the first one was social constructivism, which I liked because it explored multiple realities, and it looked how meaning was created towards objects or things, and it also explored social, historical, cultural, and structural factors that influence the adjustment process. I also looked at Ager and Strang's integration framework, and I particularly like that because it looked at integration and the roles of policy, resettlement, and migration. So they looked at how access to employment, housing, education, and health shaped the adjustment experience. And they also explored assumptions and practice, so access to citizenship and rights and attitudes about those towards the immigrants and refugees, and how that in turn shaped adjustment experiences as well. In addition, the other points of the framework that looked at integration, which I'm framing as adjustment, is what opportunities existed between and within groups to connect socially, and what structural barriers existed in countries, which also influenced the adjustment experience. So prior to that, I had considered looking at the acculturation model, which looks at 4 different styles of acculturating, and I felt it didn't quite fit in terms of what I had wanted to study. And then I also looked at intergroup threat theory, and the basis of intergroup threat theory is realistic threat or symbolic threat. So realistic threat looks at, is a host country citizens threatened because there's like more competition for resources such as housing and employment and things like that. And symbolic threat had to do with uh, dominant groups fear, symbolic fear that somehow having having refugees in their country is going to somehow like threaten their identity. And then intergroup contact theory also, I felt, didn't fully explain things, because it basically, in essence, what it said is if structure supported increased contact between groups, then there would be less conflict between groups and there would be more acceptance. And so those were some of the theories I had looked at initially. So the methodology I used is IPA, and so some brief principles of IPA includes phenomenology, hermeneutics, and ideography, which is akin to indigenous psychology. So what that says is I like this, I liked IPA because it gives voice to groups that are not necessarily represented, and it gives an insider's perspective. So data collection, I interviewed 8 humanitarians that provided services to Syrian refugees, and they were between the ages of 25 to 65 years old. I used phenomenology and bracketing, and I did semi-structured interviews, which I mentioned earlier. There were about a little over 20 interview questions that I asked, and I used purposive and snowball sampling. And I directly recruited participants through prior contacts, and I interviewed the humanitarians via Skype or GoToMeeting because they were in various different countries. This is the 6 phases of IPA. So I did multiple readings of the transcript, note-taking, developed the emergent themes, and I looked for the connections and relationships between the themes before I moved on to the next case. That's the terminology that's used. And I identified patterns across the cases. So a brief look at some of my participant demographics. As I mentioned, I had 8 participants, and I had 3 males and 5 females. Their education ranged from master's level to board of psychiatry, and there were 8 self-identified ethnic groups, 7 languages that were spoken between the participants, and the time frame that they worked with Syrian refugees included anywhere from 9 months to 5 years. And many of them had worked with Syrian refugees in multiple contexts. So up to 14 countries were represented where they provided services in. And there were 9 types of interventions that were used. Their occupation varied, and there were about 6 types of organizations that were represented, and the participants lived in 7 different countries. So here is a brief overview of my results and my analysis. There were 8 superordinate themes that were identified and 26 correlated subordinate themes. So the 8 main themes were conflict and drivers, media and politics, adaptation, difficult and stressful circumstances, access to resources, barriers, acculturation, and refugee reception. And then I broke down a brief meaning of each superordinate theme. And the recurrence is basically the amount of times participants made meaningful statements regarding that theme throughout the transcripts and the interviews. So conflict and drivers basically talks about, what are the contributors of intergroup conflict, which in turn shaped their adjustment experience. And then the role of media and politics talks about what's the discourse on refugees and receptions and their influence on the adjustment process. Adaptation talks about the various factors that shape the adjustment experience, and difficult and stressful circumstances discusses the factors that contributed to difficulties in Syrian refugees being able to adapt to their new host country. Access to resources is what types of resources were accessible in the host countries and communities that the refugees had migrated to, and what were the barriers in those host countries and communities to accessing those services. And then the 7th one is acculturation. So what was acculturation in host countries and communities? The final one was refugee reception. So how were refugees received in their host countries and communities? So as you can see, there are a lot of statements on acculturation, access to resources, and barriers, as well as refugee reception were the highest ones. And so this is a further breakdown of each superordinate theme and their related subordinate themes. So under conflict and drivers, the subordinate theme was religion, ethnic, sectarianism, and extremism, and how those drove conflict. And then tension, conflict, and violence that existed that also shaped adjustment experiences. With media and politics, I had another 4 subordinate themes, including what was a media agenda, what styles of media existed, what was a political agenda, and politics and attitudes. Adaptation, I had another 4 subordinate themes, which is what are the adaptability factors that shaped adjustment experiences? How did support systems influence adjustment experience? The concept of refugee helpers. So what that is basically refugees that also worked and provided services to other refugees. So they were not only a refugee, but they also provided services as a humanitarian. How did that shape their adjustment experience? And then the role of organizational interventions that influenced adjustment processes. The other subordinate themes under difficult and stressful circumstances included the loss, trauma, and psychological suffering that refugees experience, the difficulty with their adjustment and the focus on survival, migration, and then dependence. Those are all the factors that shape difficult and stressful circumstances. And then under access to resources, that was related to resources as well as refugee status, what their living circumstances were, and the type of organizational support they received. The barriers to adjustment included system barriers, as well as country and system changes, bureaucracy, and functionality of a government. And finally, the final two superordinate themes include acculturation, and the subordinate themes include acculturation strategies, organizational integration of staff, that looked at how humanitarian organizations had integration of their staff and how that influenced the adjustment process as well. Sponsorship, mentorship, and the role of informal networks in adjustment processes. And then refugee reception, what were the levels of welcoming in host countries? What was the cultural flexibility in those host countries? And then the connections that were available in the host countries that all influenced the adjustment experience. So I wanted to share some of the excerpts from the participants to give you a little bit of a flavor in terms of some of the things that have been shared. So under the superordinate theme of conflict and drivers, and the subordinate theme of religion, ethnic sectarianism, and extremism, participant 4 states, if they were from different parts of the country, a lot of effort had to go into team building, joint activities, creating safe spaces during team meetings for discussion, and trying to create that space that you're not being judged here. That took a long process. I think it took longer with having managed different staff and other emergencies. I think it took longer for me to create that team with the Syrian staff. And then under media and politics, another participant states, the media played an important role in exacerbating the stressors. That's controlled by countries who want the crisis to continue. So they send sectarian messages to people. People who wanted the establishment of a Kurdish state, they called for Kurdish people to separate. The media that wanted the regime to continue defended his wrong approaches. And when they say his wrong approaches, they're talking about Bashar to the crisis. And so the media in the end is controlled by politicians. So what you're seeing is how this conflict, how the role of the political agenda and the media agenda influence the adjustment process and attitudes towards refugees. Under adaptation, another excerpt is because these were the factors and the role of refugee helpers in shaping their adjustment experience. So when Humanitarian stated, even though we saw so much evil related to the conflict, and sometimes it was almost unbearable with the team of Syrians that I work with, I saw the most goodness. And so they talk about how it was amazing to work with these teams in really difficult circumstances that responded to the needs of other Syrians and were open to learning. And then another participant gives an excerpt on the difficult and stressful circumstances, particularly related to refugees that were taking higher risks migrating through the Mediterranean because their experiences in the host countries were, there were a lot of safety issues. They talk about how there's no sound solution. Countries are filled up with the crisis and the needs of Syrian refugees. Sensitivities are increasing in the host country. People prefer to take the risk of their life and try to cross the Mediterranean to Europe. So under access to resources, another participant shares of the resources that are available in Germany, especially if you're able to master the German language. They could have access to universities which are free. And they talk about how there's a lot of help in their own view in terms of what's available to refugees in Germany. And then another one talks about some of the system barriers that refugee children experience. So they they had to learn two different languages at the same time. They had to learn English in a Spanish ESL class, and it was very difficult for them. And then in terms of acculturation, another participant talks about the role of sponsorship, mentorship, and informal networks. So they talk about mentors working with refugees. That becomes a trusted support system for them, helps them learn the language, but it's also an opportunity to exchange information about the refugees' culture, and also the mentor learning, sharing about their culture. So it sounded like it was like an equal share and learning experience. And then refugee reception, the levels of welcoming. One participant shares about the different levels of welcoming within a country, maybe even within a city. So some of the factors that contributed with that is, are they used to having a lot of Syrians or having contact with them? Or is this a new group of people that they're coming into contact with? Um, and and how many Syrians are in that country or in that region? All those factors influence the levels of reception and welcoming within the host country and region. So a brief discussion. I want to make sure we're good on time. As I mentioned, there were 8 different superordinate themes and then related subordinate themes. So I broke it down by each superordinate theme. So in terms of conflict and drivers, all participants validated that conflict and drivers influence the adjustment experience. And so there's multiple discussion points, but the ones that I thought I would talk about there were 2 main categories of intergroup conflict in the host countries. And that had to do with competition for resources, as well as the symbolic threat that that the host country citizens may be experiencing, related to basically another group of people with a different culture, and fear in terms of how that would potentially diminish their existence or their cultural reality or their cultural identity. And then despite that, some groups did not fit this criteria. So despite the competition for resources, for example, in places like Greece, according to one participant, their shared identity and history of being refugees, or their shared experience of poverty in certain rural areas in Turkey, even though there was a competition for resources, it did not fully, there was no conflict, even though those points existed. And then, in also, even though there were competition between groups, or even there was also competition between groups, even though they had common ethnic and religious background in other areas. And then media and politics, all participants validated that superordinate theme as well. And there were 2 different types of description of media, of refugees. And the political changes in the Middle East viewed refugees basically depending on their alliance with the Bashar al-Assad government. So basically, a country's view and their alliance with Bashar al-Assad influenced their attitudes towards refugees and the treatment towards them. And then adaptation, all participants validated this superordinate theme. So refugee adaptation was dependent on support systems. So places like Germany, where they may not have access to their families, or they may be worried about their families back home, they were able to create these pseudo family systems in the dorm settings that they lived in. And because of that support system, that helped with their adjustment processes. The amount they're able to adapt, so, their language skills, their openness to learning about a different culture, all those things influenced the adjustment process. and what access to resources they had and organizational interventions that help facilitate that. Under the fourth superordinate theme, difficult and stressful experience, this was also validated by all the participants. All of them had experienced some type of loss. However, not all of the refugees exhibited symptoms of trauma. And I think that's incredibly important to recognize, because I think sometimes there's a tendency to pathologize some of the symptoms they may be experiencing, which are normal symptoms considering the types of experiences that they've had. And then access to resources, all participants also validated this superordinate theme. So the role of the refugee status, where they live, because some of them had restrictions in terms of where they could move and live while they were going through this resource process, the refugee status, the resources they were able to access, the type of organizational support they had, and how that influences the refugee adjustment experience. The sixth one talked about barriers. So one of the things I had looked at also with this was Transparency International is an organization that basically looks at the corruption level in the country, which also there's a correlation between that and access to resources and equality towards accessing those resources. So when I had talked earlier about the functionality of a government, that also applies to how the government functions and the corruption level within that country, which in turn influences equality and access to resources. And then the other thing that I noticed was some of the countries made changes, such as Germany, to accommodate the refugee influx, or in other countries, they increased barriers towards migration. I think Hungary and some other countries were reported in my dissertation as increasing barriers towards migration. In terms of acculturation, I also looked at organizations were required to integrate international host country staff and Syrian refugees within that organization. So the acculturation also happened for the humanitarians that worked with Syrian refugees. And the process is iterative and multi-directional versus unidirectional, which is depicted by Barry and Sam. The final superordinate theme is refugees encounter different levels of welcoming within the same country, which I had mentioned earlier. And the adjustment was shaped by not only the cultural flexibility of refugees, but also a cultural flexibility of host country citizens towards refugees and their level of openness and flexibility towards receiving them. So the limitations of the study included, it was a small sample population, and sometimes there's a lack of generalizability of qualitative research. And the providers that I looked at provided MHPSS services, but there were also other humanitarian providers. And then the study covered different forms of humanitarian interventions, as well as different forms or organizations. And there's a variance in experience and context of providers, and the interviews were with humanitarians versus refugees. The recommendations I made are in three main areas. So the first area is international psychology. The recommendation was looking at the role of social media and other forms of media, and doing more studies in terms of how that influences the adjustment process, and measuring the types of assistance media provides to refugees. So for example, in Turkey, the role of Facebook, as well as in Germany, was incredibly helpful in developing these informal networks that refugees were able to have in those countries. So they were able to adjust more as they were able to find help through these sections. And then the other important information was looking at the influence of culture and how that influences psychological distress and resiliency. for humanitarians, the section on humanitarians, the recommendations were wanting to do a study of humanitarians' lived experience in complex emergencies and exploring their cultures. So, such as either doing a ground of theory study or an IPA study. And then also doing a IPA study or ground of theory study with non-traditional humanitarians using Skype. And the reason I mention Skype is because of a lot of the non-traditional humanitarians work in conflict settings, which are incredibly difficult to gain access to for a variety of reasons, including safety and security issues and difficulty with getting IRB approval and multiple other factors. So it could be a safer way to do those studies. And then organization and systems, the recommendations I had was to do a review of different countries and their policies and departments on integration and migration. So maybe taking a look at how different countries, what their policies are towards refugees and immigrants on integration and migration. What kind of resources do they have? What kind of policies do they have? And then the other recommendation is to provide training and ongoing support for humanitarians that work in conflict settings. The implications I also divided up into 3 sections. So for international psychology, we looked at what were the contributions made by refugees. As I mentioned, a lot of them worked, despite the fact that they were refugees themselves. They supported other Syrian refugees in some of the difficulties that they were experiencing in their host countries. Information on xenophobic attitudes towards Syrian refugees related to media and politics, as well as how media and politics also in some instances increased empathy and support towards Syrian refugees. For humanitarians, the implications were there were diverse types of humanitarians that work with refugees, and the role of volunteers, researchers, mentors, and faith-based organizations is an adjunct to traditional forms of humanitarianism and humanitarian work. So particularly in Canada, a lot of faith-based organizations are providing sponsorship to refugee families, which has been, as well as in the United States, which has been incredibly helpful in their adjustment process. For organization and systems, the comparison of access to resources, barriers, support, education, and employment in various contexts, like what was available to them, and the role of universities in facilitating cultural exchange and as a key source of support and advocacy for refugees. So that was particularly evident in Turkey, where the universities took on a major role in facilitating cultural exchange. And in some instances, the United States, but it was definitely very evident in Turkey. So additional recommendations include increased training about the context of a country and the population that humanitarians will serve prior to their deployment, and doing risk assessments for humanitarian during all phases of deployment. So from my understanding, it seems like there's some psychosocial support that's offered beforehand and then when they return. But during the time when they're deployed, which is the most difficult period of time that they're experiencing, I haven't seen that much evidence of ongoing psychosocial support that's provided during that time, and debriefing during all phases of deployment. And the additional recommendations based on the literature review was increased need to standardize and professionalize the field of humanitarianism. Some of the challenges that humanitarian workers faced, even though this study wasn't particularly focused just on humanitarian workers' challenges, is the increased safety issues. There has been more literature related to increased humanitarian deaths in the regions that they're providing services to and the increased threats that they're experiencing. Working in weak or damaged infrastructures where there are limited access to resources, working in places where there are non-existent structures, for example, for mental health or other resources such as housing and employment. And humanitarian emergencies have become increasingly complex through the years. As I mentioned, there's been increased loss of lives of humanitarians that's been documented. The degree of burnout that they experience during deployments, I believe they work 12 plus hours, multiple days, 6 days a week, high turnover, limited resources to meet the needs of the population served. And I put Katrina just because that's my experience providing disaster mental health services. But, you know, think of that as amplified for low income and middle income countries. A sense of helplessness that they may experience and not being able to provide the help or support based on the excessive needs that they see with the refugees that they work with. Refugee helper, as I mentioned, is a particular type of humanitarian worker who's dealing with the anxiety and fear and worry about not having contact with their families and their own adjustment issues while they're providing supports to their fellow refugees. And supervising teams with members from diverse ethnic, religious backgrounds that are in conflict, that team building that one of the participants had mentioned. There's also a lot of moral and ethical dilemmas, which I won't really have time to get into. So some of the case examples were the things that happened with Rwanda genocide and Zaire refugee camp, as well as in Syria, where workers faced moral and ethical dilemmas. The social political situation on the ground. So, you know, some of the countries, humanitarian organizations were continuously threatened with losing access to providing services or having permission to continue their services in the country. Duplication of services and maybe the ethics of certain organizations was something that another humanitarian had mentioned. Navigating complex in-country and political issues. And then also, you know, the vicarious trauma that humanitarian workers face. So witnessing atrocities, lack of resources, sense of helplessness, and difficulty meeting the demands of the population. So some of the barriers to doing research with vulnerable groups and international research includes some lack of clear guidelines and information about doing research internationally and IRB approvals, difficulty getting IRB approval in regions that are considered conflict zones or where there's increased safety risks, as well as difficulty doing research with certain groups, including refugees. Challenges in building communication and building relationships with organizations and contexts in different ways given the distance and changing political landscape and situations. So at this point, I would like to stop and see if there are any questions.
Absolutely, absolutely. We thank you so much, Dr. Rami, for this amazing presentation. We do have some questions, and I'll go ahead and start with our questions. Our first question is from Furpo Carr, and it says, before I ask my question, I'd like to say that I did a study similar to your own very impressive and comprehensive study, having visited some of the same countries you visited, including Kosovo, whose country status is questioned. Now my compound question. Did you happen to explore the plight of Syrian refugees in Jordan, as well as the humanitarian effort of Saudi Arabia towards those refugees?
Wow. Well, Furpo, I'd love to hear more about your study. That sounds very interesting. And yeah, Kosovo was an amazing country to visit. Um, I did happen to explore the plight of Syrian refugees in Jordan. Unfortunately, because of the um, limitations of studying multiple countries comprehensively, I wasn't able to get that many information. But one of the humanitarians that I interviewed had actually multiple humanitarians that I interviewed. I think at least three of them had worked with Syrian refugees in Jordan, as well as in Egypt. Sorry, I have all the countries listed down. So all of those neighboring regions, Jordan, Egypt, Iraq, um, Lebanon, and Turkey were the five main neighboring regions. And I did not, unfortunately, have that much humanitarian information in terms of humanitarian effort of Saudi Arabia towards those refugees. But my study did include information of the plight of Syrian refugees in Jordan. And then humanitarian organizations. Also, one of the refugees was also, two of the humanitarians had also provided services in Syria as well. So I was able to gain information on the humanitarian efforts that were happening in the non-traditional humanitarian organizations that were in Syria. And there's a lot of cross-border projects that were happening from Turkey to Syria because there was some difficulty gaining access in Syria. So I don't know if I answered your question or not, but my study did touch upon it.
We have another question from Deborah, and she says, "Thank you so much for your talk. I learned a great deal about humanitarianism that I did not know before. In your dissertation study, you interviewed adults. In any of the interviews, were children and adolescents discussed? In your talk, you mentioned system barriers and children learning two languages at the same time. Were other barriers for children discussed?"
Hmm. Thank you, Debbie. That's a great question. So the interviews that I did with humanitarians, they provided the adjustment experiences that adults were facing, and not so much children and adolescents. Although I can tell you from my own experience, I did a field experience in Germany, actually. And then I had also spent another 4 weeks there to see what the humanitarian situation was like in the ground. We had met a couple of, um, I had met an adolescent, actually, a few of the adolescents in one of the shelters that we had visited. And they, he was, well, an unaccompanied minor that came with his older brother, but just like early adulthood, and some of the difficulties that were faced in talking to the shelter manager as well as the adolescent was the difficulty in not being able to have contact with their family, as well as um, not having information about one of their other siblings and the experiences that they had migrating through the Mediterranean, and then to go through that only to go through multiple countries through Europe, and having that experience of knowing when not to get off on the train as they saw angry hordes that were protesting migrants coming to their country, and instinctively knowing that that was not the country that they were supposed to get off on. And then the other difficulties included bullying that the adolescent experienced in high school as they try to adjust to the new country. So those were some of the things that have been experienced with children and adolescents. But in terms of the children and adolescents in the United States who had migrated with their family, they initially had barriers with missing their country and the limited resources, even in the United States, in the area that they were living in, which was a little bit more impoverished, and not having Arabic teacher, and so they were having to learn English at the same time in a Spanish ESL class. So, as I mentioned, like the bullying that they experience, having to learn another language, going through the process of, adolescent developmental issues, dating. Those were some of the system barriers that were recognized, as well as the need for dependency in certain areas due to a lack of transportation. So if you don't know the language, how do you understand the signs which tell you what bus to take, or in some areas where there's limited transportation and you don't have a car, then the need to depend on other people to take you to appointments and navigating those kind of systems and resources. I hope that answered your question.
We have another question. We've got time for just maybe one or two real quick ones here. This is again from Ferpo Carr. When I was in Greece, I interviewed Syrian refugees who were virtually all Muslim. I
Mm.
saw firsthand the dynamics of intergroup threat theory. For example, the few refugees who showed an interest in Christianity did so clandestinely for fear of becoming victims of violence heaped upon them by their fellow Syrian refugees who were Muslim. Did you explore in detail this situation in particular as well?
Wow, what a great question. Unfortunately, I didn't, but it sounds like very interesting to explore that further. The other thing in terms of intergroup threat theory that I heard was occurring in Greece, as well as maybe some other parts such as Germany. So this doesn't necessarily respond to your question, but in terms of intergroup threat theory, what was happening is, especially in Greece, is there was increased competition between the different refugee groups because some refugee groups were given a little bit more preference towards quota. There were different quotas in terms of how many refugees from each country were going to be accepted. So that created some increased tensions and violence in Greece. And then I think there was some changes in quotas in Germany as well, related to how many refugees were going to be accepted. So yeah, I would love to talk to you more about that on the sideline.
Yeah. And we have one last question from Joelle. How do you think the perspectives of refugees on some of the system barriers you're highlighting may be similar or different from the perspectives of the humanitarians you interviewed?
Mm. Yeah, I think that's a great question. So, I went through many different processes of completing this dissertation. So initially um, I had wanted to do my study with refugees, particularly in the border regions in Turkey. There were a couple of different border cities that I was looking at, and I had actually really wanted to look at how host citizens were viewing refugees and what perceptions refugees had of the host citizen. But I had an incredibly difficult time getting IRB approval due to security issues in those regions. And one of the reasons I chose humanitarians actually, and I ended up choosing them individually versus through their organizations because I think there was a lot of politics involved in terms of going through organizations due to their fear of um, losing access in the country. So I chose humanitarians because I felt like I was gonna be able to ask them these difficult questions that I was not going to be able to explore with refugees without a lot of barriers through the IRB process, and also placing them at increasing their safety issues. So, but yeah, I mean, I would definitely like to explore that with refugees. I think it just needs to be done maybe in a place that's a little bit more secure. Um, Perhaps like in Germany might be a safer place to explore that.
Thank you so much. Unfortunately, that's all the time we have for questions. We had many, many more that you could have answered and discussed with us, Dr. Rami. So we would like to thank you for spending this hour with us. And we also want to thank our audience for participating. We'd like to hear back from you about this webinar. Please, please provide feedback on your experience about both the content and the format of today's discussion. If you register for APA approved CE credit, you will receive and must complete the Qualtrics hosted online survey. And if you don't see it in your inbox, please check your spam box. And remember that your CE certificate will be automatically and instantaneously generated and emailed to you. So on behalf of Division 52 Webinar Committee, please enjoy the rest of your day. Stay safe, stay healthy, and enjoy your upcoming weekend. Thank you again, Dr. Rami.
Thank you so much, Karen. This was wonderful. I hope everybody has a wonderful day.